I think nowadays in terms of rehabilitation, we look a lot more into core strengthening and pelvic stabilisation with our rehabilitation. And that's improved a lot of patients, especially those that may have mild hip problems. And most of my patients do make a good recovery after 2 or 3 months of rehabilitation. Injections for the hip, usually they don't do so well, just because of the general anatomy of the hip. Medications mainly involve anti-inflammatories, and then I suppose the next one is arthroscopic or keyhole surgery. That's relatively new for the hip, and I suppose not many people do it because of the hip joint itself is actually deep within the body, so you need very specialized equipment to be able to perform that sort of surgery. But now we're doing a lot more of that, especially with a lot of the ligament tears around the hip, and patients have good results with that. If patients, in the more elderly patients that may require some sort of hip replacement surgery, we are moving into robotic type surgery for that, and that's a fairly exciting new field that we're looking into.